This video is intended to show you the movements that are difficult to describe in the back mechanic book. Movement and exercise can decrease or increase pain. Use the guidelines in the back mechanic book to guide your decisions on which to do and which to avoid.
We're graduating on to the final module now, where we're building a level of movement competency and athleticism to help you reach all of your movement goals. Read all of the tips and guidelines in back mechanic. We are now up to chapter 12 of back mechanic, restoring the hips. There's a tendency of many clinicians to tell patients to stretch their hamstrings. This, unfortunately, prolongs their back pain. Instead, we are going to first mobilize the hips and then build some muscle patterns. So the first exercise, the hip greaser, or as it's known, the hip airplane, begins like this. You will stand. You will place your thumb on your rib cage and your fingers on the little bony protuberance there, the anterior superior iliac spine. It doesn't matter, just feel the front of that hip bone. Now, your hands are locking or giving you feedback to lock your rib cage onto your pelvis. You're going to stand on one leg and push the heel away of a straightened leg on the other side. Now, the hip grease part is you roll your pelvis down into hip internal rotation and then around into hip external rotation, all at the hip joint. Do not allow the rib cage to leave the pelvis and twist the spine into pain. There's the hip greaser. And then to add a little bit of challenge to it, some of you may want to spread your arms out, get into position, and lock your rib cage to the pelvis, internally rotate and externally rotate. Around you go. Come on up, come on, and then back down again. With many back pain patients, they will have after effects of the hip muscles. This is well known in pain science that hip pain and back pain tends to inhibit the brain in activating the gluteal muscles, and it adds facilitation or an overstimulation to a muscle in the front called the psoas. And we've measured this in many back pain patients. These are the two very best exercises to address this. Is this a problem with every back pain patient? No, but it's a problem with a good proportion of them. So if you feel a tightness and you perceive it as your hip flexor, it is most likely the psoas muscle. This is the very best stretch to release that facilitated psoas. So again, take a lunge position, and you can actually feel the psoas tendon. This is the middle quadricep called rectus femoris. If you place your fingers on that high quadricep muscle and just pull your fingers medially into the notch underneath the inguinal crease, you're right on psoas tendon. And you will feel a flexor stress, but no tension on the psoas tendon. To get the psoas tendon, you raise this arm up overhead and you must push quite strictly to the ceiling. So push to the ceiling and bend away, then all of a sudden you feel that tendon under your finger. And that is the psoas tendon. Some of you have anatomical connections called anatomy trains and fascial connections between your arm and your psoas muscle, believe it or not. And if you push your heel to the ceiling and rotate your arm around in a rotational manner, you will find different pulls on that psoas muscle. All go to releasing it. Following back and hip pain, there's a tendency for the brain to not utilize the gluteal muscles as they normally would. So to recondition those patterns, we ask you to place your thumb on the front of your iliac crest, that bony protuberance right there, and that's simply to target your fingers so you can feel this high gluteal muscle, or the outside of your butt muscle, if you will, activate. So the movement begins like this. Keep your ankles together and open up your knees like a clam and go back again. Now I don't know if you noticed the substitution. She rolled and used her back. She pulled her hip open by pulling her hip back. Basically, she deserves her back pain if that's her strategy. So this time, I'm going to ask her to push my fingers out with the brace that you now know very well. Stiffen your core, support your back, and just allow the hip joint to drive the clamshell movement, opening up, well done, and back down again. And if you like, you could place a sandbag on your knee and open up your knees and back down again. And this is giving feedback to your mindfulness while you're doing this exercise. Focus your brain on that muscle and feel it work as you do the clamshell exercise. Getting this back into the pattern rather than using your back to drive that external rotation motion, which, by the way, is a fundamental motion for if you want to play basketball, tennis, volleyball. You are going to have to redevelop the drop step both ways. You will need to stiffen your core, drive from that supporting leg, the drop step. Fundamental for athleticism in a pain-free way, but this is the building foundation component. Those back pain patients who have the inhibited gluteal muscles following pain will usually need to do a second exercise. The first one that I showed you was for the outside or the glute medius muscle. This is more for the bulk of the glute muscle or glute max. I'm going to get you to try and image squeezing your glutes and see if you can activate those muscles. So just turn on your gluteal muscles, don't come up. Just squeeze your glutes and turn them on and relax. So your strategy for turning on the gluteal muscles was to do a pelvic tilt and flatten your back into the floor. That's a flaw and that's going to cause pain. So this time just put your hands under your low back and don't increase the pressure on your hands. Just mildly squeeze your gluteal muscles and let them go. No, you're still using the strategy of bending your pelvis and bending your spine to activate the glutes, and this will cause your pain. So hold your pelvis here now, or at least control it in this position, and mildly squeeze your glutes. Not so hard. You're trying to bodybuild and be too strong. Just connect your brain to the muscles and relax. Relax and turn them on, squeeze and relax. Very good. So use that pattern now, that thought of activating your gluteal muscles, and strengthen that thought and use them to come up in a back bridge. And I'm going to palpate your hamstrings or feel them to see if they activate too. So squeeze your gluteal muscles and up you come and go back down again. So that's very good. You were able to do that with just your gluteal muscles. Some of you won't. Some of you will feel your hamstrings activate. The trick there then is push your toes against a partner or against the wall and push away. Try and kick away to activate the quadricep muscles. So push your toes into my foot, kick away, and keep that pattern going. And I'm going to even add a little external rotation. Push your knees out. There is the hamstrings quiet, a little bit of quadricep. Now add the gluteal squeeze and up you come, and there's absolutely no hamstrings at all. And just practice coming up and down. But I must warn you, this exercise is not for everybody. If it's done too early in your rehabilitation program, you will actually increase your back pain. So this is to be saved till quite late in the restoration program for your back. Many of you have been told that you need to squat deeply and do repetitions to preserve that ability as you age. I disagree. What I learned in Russia and Poland is that just do one deep squat per day will actually help your hips and back, whereas doing a few more repetitions will have the opposite effect. Start with your hands, palms facing up, and roll your hands and arms forward as you go down into that squat, and just sink into a deep squat and completely relax. And just sink into the bottom of it and then slowly build up tension. Position your back perfectly, and then pull your hips through. Stand up nice and tall. Just one repetition today is the medicine. Now we progress to building pain-free motion in patterns. The first pattern is a push pattern. Instead of beginning the push with a traditional push-up on the floor, which is sometimes challenging for back pain patients, we're going to start pushing on something that is waist height, in this case a bar. So we will begin the push-up position, baby step away, and again be mindful of the curves of your back, and the right amount of stiffness that you've discovered makes you very resilient. So just do a simple push-up, down you go, and back up again, and keep organizing that perfectly resilient spine. Now add a bit more athleticism and push so that the momentum carries you through to upright. So stiffen and push, and fall into it, and come on out. And again, if I may, as you're falling into the bar, you're freezing your hips and hinging through the spine. And then your hips are the first movement to come out. Versus if you could organize it that you're perfectly stiff all the way through and absolutely minimize any chance of a pain trigger. To start pull patterns, we might use a device like these TRX straps, and we'll ask you to grab the handles and lean back with your arms straight. And I'm just going to buttress her feet with my foot just so she doesn't slide away. Now, organize once again the back into that beautiful injury-resilient, pain-resilient posture. Pull down with your shoulder blades, we call it centration, and organize that perfect spine posture and squeeze the handles harder than you need to again further stiffen your back, and pull and rotate your hands into a hammer grip as you come into your armpits, pull up, pull them into your armpits, into hammer, and go back into what we call a pronated grip. Very nice. Pull, and no pain at all. Really building the back muscles, not close to a pain trigger. And then eventually, if I may, can I just have those? You will become very robust as you build that pain-free, resilient back. Lean right back, and with full body weight, pull into the pulling posture, and learn to power breathe. And you'll find that's a very special tool for building a lot of back strength without going near a pain trigger. Chapter 14 of Back Mechanic covers special conditions. Let's discuss stenosis. Those of you who've been diagnosed with stenosis have been told to slouch, use a walker, and don't extend your spine. This will work for some of you, but it will cause more pain in some of you as well. If that causes you pain, I'm suggesting you try the opposite. We've had terrific success with those who don't do well with flexion and stenosis. Let's use the example of you can walk for 2 or 3 minutes before the stenosis symptoms come and the leg pains start. If you get leg pains after 2 minutes, around the 1.5 minute mark, go and find a park bench or a surface where you can put the heels of your hands on the back of the bench like this, push down in an anti-shrug, and bring your weight of your body up over your hands, and then move your hips towards the park bench. Do you notice that I'm becoming taller and moving into slight extension? You will know right away whether this is relieving or it's causing pain. If it's relieving, try and stay there for 30 seconds, perhaps 40 seconds, and then come off the bench, and you will find you'll be able to walk another 2 or 3 minutes without the stenosis sensation. Then just before they start again, go back to the back of the park bench, Place your heels, get up on top of the bench, traction your back, and allow the hips to fall to the bench and just enjoy that relieving traction again for about half a minute, and then go and walk for another minute or two. This is an interval training approach to extend your walking time, and you will find over a few weeks of that regimen, your stenosis symptoms will resolve. For those with stenosis and who did well with the park bench decompression that we just did, you may also try wall walking. So find a wall or perhaps a tree in the park, put your hands on the tree, relax, and then take small steps up the tree. As you're walking your hands up, allow your pelvis to fall towards the tree. Sniff air. Expand your lungs and extend your spine, and then walk down again. And some of you will find that relieving as well, but not all. Some of you will have been diagnosed with stenosis, but also perhaps kyphosis. Kyphosis simply means a curved upper back like this, and perhaps a chin poke or a head down kind of posture. Here is a wonderful thoracic spine extension stretch that will get you out of pain if that is your particular pain trigger. I'm going to first show an assisted stretch and then how you can do it on your own. So interlace your fingers like this and place them behind your head. Now, you keep your knees in that position. Just give me your elbows and come to me now and lean on my arm. So if you're working with a therapist, show them this stretch. I'm going to pull your elbows together, again taking care of your shoulders. I don't want to flare up any shoulder issues, but you will feel a stretch through here, and through here. I'm being very careful with your low back as well. So I'm just going to ask you to, that's it, just straighten your back just a little bit. Now, push down into me through your elbows, just 2 or 3 pounds or a kilo or 2. That's all. Push down, and you're going to hold this for about 10 seconds. It's called the PNF stretch, proprioceptive neuromuscular facilitation. Now, release the stretch and watch, or the pressure on the elbows. Watch, I'm going to pull the elbows forward. And did you see the extension that occurred in the thoracic spine? Again, never cause pain, but you should feel a nice self-release. And we'll do another cycle. Just push down through your elbows into me. Very nice. We're going to count to 10, 7, 8, 9, 10. Relax, pull the elbows forward, and we've got a beautiful extension of that kyphotic spine. So standing up nice and tall now. You see, posture is the function of hardware and software. We've given her the hardware now to be nice and tall and alleviate the stress and pain triggers in her back. Now it's a matter of software, conscious effort to maintain that posture without pain triggers. Now we're going to change that assisted stretch into an unassisted one that you can do on your own. So once again, interlace your fingers. Put your hands behind your head. Put your elbows on a stool or a surface that's about the same height as your hips. There we are. Now, try and spread out over the support. Be careful of the curve in your back and start to push through your elbows down into the table. Don't get too strong now. Just a couple of kilos per elbow. Count to 10. 7, 8, 9, 10, and then relax and pull your buttocks back to your heels, and you see the release that she gave in her whole thoracic spine here. Try that for 2 or 3 cycles, as long as you're feeling no pain and a nice extension pattern, and you will achieve the, you can get up now, you can achieve that nice tall posture dealing with the progressive kyphosis. Some of you experience mid-back pain and upper back pain when you're sitting at work. Take this test. Slouch in your chair and watch in a mirror your strategy for sitting upright. Some of you with mid-back pain will move right here. You keep this still and you lift your rib cage so you see that all the motion is right where the pain is. The corrective on that is to spread the knees apart just a little bit, and through the hips you roll your pelvis forward and align your spine for free, taking out the stress concentration right at the pain site. So it's rolling the pelvis through the hips. If you have tight jeans, for example, or a tight skirt, it's not possible to do. So wear looser clothes about the hips, perhaps pleated pants, for example. Those of you with more upper back problems usually will be able to see your postural habits. As you're working, you may see your shoulders elevate as the shoulders are brought up to the ears. Just put your hands down and relax, and keep trying to correct into that relaxed neutral posture and take yourself towards less pain. Well, we're already at the final chapter, chapter 16. Read about all of the questions you were afraid to ask, how to have sex with no back pain, understand your pain triggers, and use styles and positions that avoid them. Well, there you have it. That's the end of our journey. You know what your pain triggers are. You have strategies on how to desensitize them in your back, and then also how to build a pain-free foundation. Some of you will still want to see a clinician very savvy and trained in our approaches. If you go to www.backfitpro.com and look under patient information, you will see a web page there of McGill providers. Many more will be added over the next year. Thank you for going through this rehabilitation journey with me. Enjoy.
Now that you are out of pain, you may wish to change your training to enhance performance. Dr. McGill's book, Ultimate Back Fitness and Performance, will guide you in attaining back performance in a spine-sparing way. Clinicians are encouraged to get the book and video, Low Back Disorders, Evidence-Based Prevention and Rehabilitation, which was written to guide you in higher-level prevention and rehabilitation approaches.